Alrighty. Well, thank you, Miss TBC, for being able to meet with me today and provide me with all the information for that family assessment. I know Mr. CBC isn't here right now, but appreciate you taking the time to talk with me. Do you have any questions for me?
No.
No, not right now. Okay. Well, if you have a few extra minutes, I have some pieces of information that I think it might be helpful to share with you. Would that be okay? All right. As we can hear, we have a little FMC here as well. So a lot of this. So, while we're going through that family assessment, one thing that we kind of touched on was that Miss FMC wasn't able to make her 12-month appointment. And I know that we're working on rescheduling that. But just wanted to provide some education about like why that 12-month appointment is so important. You probably know a lot of this, but a lot of these visits are a lot more than just measuring like height and weight. It's a comprehensive look at your child's overall development. It's a key moment for disease prevention. So the first thing that they're going to do is they're going to be tracking growth and development. So they'll measure your child's head circumference, her length and weight, ensure that she's growing steadily due to her own curve. Miss FMC is very tall, so I know that curve is a little bit different, but it's a prime time to access exciting developmental milestones and assess them. So like she's pulling up her head to stand, using little gestures and words and saying little things, mama, dada. Exactly. And she can play games like peekaboo. So they're going to test out some of those developmental milestones and you can gauge the progress. But it's also a good time to ask questions to your provider and the staff there. And I know that there's always lots of new questions that tend to come up, especially as they continue to grow so much in the future. So, a lot of people like to discuss things about like nutrition and transitioning away from milk potentially into more like table foods, sleep habits and routines as those continue to change in the future, and then safety proofing the home, especially now that she's walking around and she's a toddler, not an infant anymore. And they can also provide you with information about behavior and discipline, parenting tips like that as well. But another huge part of all that is receiving her 12-month vaccinations. I know you've done a good job so far on getting all of her like 3-month, 6-month, 9-month ones, but just because she has those, unfortunately doesn't mean that she doesn't need some more. So ones that you can kind of expect at this time are going to be the MMR, the varicella, and the hepatitis A. Some offices are a little bit different than others, but I'm going to definitely get those underway, especially those 3 she hasn't had, so they wouldn't be boosters with her at that point. But I mean, they're a safe, effective way to teach your child's immune system how to recognize and fight off serious diseases without, having her have to get sick first. So, and I don't know if you know about like the MMR right now. We actually are having cases of measles popping up. We had one in Forsyth County a few months ago, unfortunately. So it's a good time, the sooner the better to get that underway. So, like I said, we'll work on setting that up and getting you over there. The varicella is going to protect her against chicken's pox, and obviously hepatitis A is going to protect her from contaminated food and water, especially as she's like touching a whole bunch of stuff and new things and putting her hands in her mouth and doing all that. So we'll get those things going. Did you have any questions though about vaccinations or why they're important or anything like that?
Are the vaccines safe?
So vaccines are among some of the safest medical products available. They undergo rigorous testing before approval and are continuously monitored. There are some very, very rare side effects, but most of them are mild and temporary. Just like a low-grade fever, fussiness, like sore red spot where the shot was given. And I know those things can be a little bit distressing as a parent, but they are normal signs, and it means that the body is building protection, which is actually a good thing in this case. Once again, like those serious reactions are extremely rare. So,
They won't make her sick.
um, they will not make her sick. No, they might give her some symptoms just for the rest of that evening, but that's actually helping her avoid getting sick in the future by creating, putting those antibodies into her immune system so that she won't have those visceral reactions in the future. So, oh no. You got any other questions about the vaccines?
Why so many at once?
That's a good question. So, your child's immune system is incredibly powerful, and is like exposed to thousands of germs every day. Especially as she's putting her hands in her mouth and all that. And a few antigens in these vaccines are just like a tiny drop in the bucket of all those ones that you can have. But when we combine them and we give several vaccines at once, it's fewer stressful office visits, and we can provide more protection for her immune system, kind of without delay, and yeah, just a little bit less traumatic in general. So that's why they often do it.
What about the diseases? Are they really so bad?
So thanks to vaccines, many of these diseases are now rare. Unfortunately, like I was saying, due to a bunch of factors, we're seeing some of them resurge a little bit more in popularity. But over time, the vaccines has really helped us to minimize that. And that's why we have to continue with the vaccinations. These illnesses can lead to like pneumonia, brain damage, hearing loss, even in some extreme cases, death. So, but the vaccines are the reason that we don't see those tragic outcomes so often today from them. So, did you have any other ones? Any other questions about that? Okay.
Not at the moment.
All right. So, a couple things you can do to prepare for your doctor's visit when we're getting there rolling here soon. We can write down our questions about development, about behavior, nutrition, parenting tips, anything, safety, anything that, you might be curious about. And it'd be helpful if you, can bring a list of any medications or vitamins that little FMC is taken, or you as well as the mother, since you're still breastfeeding. You can note any milestones that you've observed, so you can share that with the provider. And there are a few tips, especially with all these shots. 12 months, she's gonna get a lot. So we're gonna allow you, or your provider is gonna allow you to, hold your child and comfort her during that whole process. And you can maybe bring some toys or create some distraction measures for her while she's over there. And then sometimes we find that like a cool wet cloth can help like soothe the injection site. They should be able to provide that if you don't have it, but even for the car ride home, it might be a pretty good thing over there. So, yeah, that was the first one that I wanted to touch on there. Probably the most important, so especially since she's so little. All right, so going over the family assessment stuff, the second thing that I had kind of noticed was that little FMC hasn't gone to the dentist quite yet. And there's a lot of parents that don't take their little ones to the dentist until a little bit later on. But I did bring you a resource here. It says the American Academy of Pediatric Dentists recommends that your child see the dentist by age 1. So you can call here to make this appointment. This is a good center that we have had in town that I know has provided resources for a lot of people. It's over about 10 minutes away from here, honestly. So there's lots of options out there. So here you go. There's that. But, if you don't know why to go, then it doesn't really matter. So I can provide you with some information on that if you're interested in that.
Yeah, why so early?
It's a good question. Yeah, you might be thinking like, my baby only has a few teeth. This is like the first visit. It's not about extensive treatment. It's about prevention and education. So they want to prevent early decay. Baby teeth are important, for chewing, speaking, holding space for adult teeth. And decay in baby teeth is something that's very real and unfortunately too common. We call it early childhood caries. It can cause pain, infection, and problems with permanent teeth. So, when we have these appointments, we can kind of establish what we call like a dental home for the child. So it's not just about right now. It's about, establishing that in the future and ensuring that they have a trusted place to go for their regular care, any dental emergencies, and can also provide personalized advice for things like feeding, teething, oral hygiene that are like really tailored to your child. And that can, be what we consider to be proactive care. So does that kind of answer your question a little bit?
Yeah. What should I expect for the first visit?
Yeah, that's a good question too. So we call this visit a lap exam. It's designed to be pretty quick, easy, and a positive experience for everybody, especially the child. It's going to start out, with little friendly introduction. Your child can sit on your lap facing you, and the dentist will just examine their mouth, kind of in that comforting and comfortable and nurturing position. I know a lot of children her age have like that separation anxiety, so we definitely don't want to put her through anything like that. The dentist, he or she, they will just do like a quick count of all the teeth that are in there, and check on their gums and their jaw and their bite, and potentially do a very brief cleaning, kind of depending on the child's comfort level and how willing they are to have somebody look inside their mouths. I know some are a little bit more willing than others. So and then they're just going to have a series of conversations with you. That's really the most important part of all this is, providing that further education and, creating those future connections. So, talk to you about like oral hygiene, like kind of how to clean their teeth on a daily basis. Especially it can be a little bit difficult when the child is so resistant to that. They're going to talk to you about like diet and nutrition and how to, especially, steer away from super sugary drinks that can kind of delay or can very negatively impact the teeth and kind of break them down in a much more substantial way. They're going to talk to you about different types of toothpaste maybe in the future, and now it's a little early for that, but providing that fluoride source will be important for her for the future. And then they're going to talk to you about potentially harmful habits, like thumb sucking or overuse of pacifiers or things like that. So all around can be a good thing, something that we definitely recommend. If that resource doesn't work out for you, we can also provide some other ones as well, if it's a little too far or whatnot, if that doesn't work. But I also saw that you and Mr. CBC have not gone to the dentist in quite some time, and understand that like dental insurance is a whole thing there. But when parents, it's not as important since your teeth aren't developing, but it's still good to keep up with that oral hygiene. And a lot of times they can be proactive and catch a lot of things that you maybe wouldn't catch initially, but could get a lot worse in the future, and especially with infections and things like that. And like I said, there's a lot of resources for those as well, for people that maybe don't have insurance in those ways. It also, as Miss FMC continues to grow up, it'll kind of create that culture in your family of like, yeah, we need to go to the dentist, and you can like lead by example in those ways. And really exemplify why pursuing that type of like proactive healthcare is important. So I would definitely encourage you guys to think about that in some capacity. Did you have any other questions about that? Nope. Okay. All right. So then, just based on some of the data that you had mentioned, I made this genogram thing, and it just, kind of helps to really, mostly we're looking at genetic links between diseases and families, especially for like little FMC. We want to be aware of, things that might run in the family. I know we have a couple on here already, but were there any other ones that you might have wanted to add to that?
History of asthma for me and my father.
Oh, okay. Yeah, that's definitely something that we can add on there. Any other ones? No? Okay. Well, that's definitely helpful. A lot of people don't know, but if any of your parents, grandparents, if we see that asthma kind of running in families, it can predispose people to contracting that in the future. So we'll definitely add that information in here, and especially for little FMC, we can provide some future education in those areas for kind of trying to prevent it. I know a lot of our environmental factors can exacerbate asthma in people that are predisposed to it. So appreciate that information. The last thing that I wanted to touch on here is this home environment safety evaluation checklist that I went down here while I was taking a little look around your apartment. So I noticed that it doesn't look like there's a fire extinguisher accessible or that's like in working order. I didn't see one anywhere. So that's kind of an important thing to have that a lot of people overlook. Even like a small fire can become a major disaster in minutes. So working fire extinguisher obviously allows us to put out a small fire before it really spreads, and to protect your family and your home, which is really what matters. So there's a few different types. We suggest using like a multi-purpose fire extinguisher that's ABC rated, and you can pick them up, at your local stores most of the time. But also it's important for me to emphasize that like placement is key. You don't want it just like shoved under somewhere that's not accessible, especially if a fire begins to spread. And we don't want the clutter, to block it anywhere like that. So I'm just trying to think about that. We usually suggest, putting it near bedrooms, or garage if you have that. But and I'm sure you know how to use a fire extinguisher. But the way that we remember it is by remembering the acronym PASS, where you pull the pin, aim the nozzle, squeeze the handle, and then kind of sweep from side to side. It is also important to note that fire extinguishers don't last forever. So, you need to check up on that. There's a pressure gauge on the side that will have a little dial on it that'll tell you when it goes bad. So, another thing that I noticed from this checklist is that there are no emergency phone numbers that are posted and easily accessible. So I saw you have a lot of stuff like on your refrigerator. There's even a bulletin board out there. So, just for yourself in an emergency, any members of the home that are there, sometimes it's hard to remember those numbers. So, we all know 911, but it's also important to have numbers like the Poison Control Center, family doctor, nearest urgent care and hospital, trusted members of the family or neighbors, and like work or cell numbers for adults that might not be there at the time. And this, just creates another layer of safety. So I have this guy here that has some of those on there. You can fill out the rest of it if you would like. And I would just suggest posting on your fridge since there's stuff there already. Then I also noticed, obviously with a little toddler, it's hard to keep everything clean all the time. But I know from what you told me, it doesn't sound like there's any people in your close family that are super high fall risk, but that is something that, we associate with kind of cluttered areas. We've just seen evidence over the years that really increases the fall risk for everybody. And I mean, just because you're not at high risk for fall doesn't mean that you couldn't be susceptible to that as well. So just trying to minimize injuries in that regard. Kind of in the same way, we want to make sure. I saw that you have non-slip mats like on the outsides of your showers, but I didn't see any on the inside. I know that can create a pretty slick surface, and can pose a high risk for serious falls or head injuries, especially is what we're trying to avoid with that. So you can pick those up at your local store too. If it's a resource that you don't have access to, we can also try to provide that for you as well. And then the last one I really wanted to touch on, or the last two here, were safe storage of chemicals and stuff. I know you're working on baby proof and everything. That's a long process. I've seen a lot of pads up and little door locks and stuff like that. But I just noticed under the sink where there's a lot of chemicals, I didn't see one down there. So obviously we don't want little Miss, I know she's never out of your sight and whatnot, but don't want little Miss FMC to get into those, is that could be super hazardous. And then finally, a lot of hot water heaters have controls on them so that you can minimize the amount of hot water that they put out. And I know when I was washing my hands, the water seemed pretty warm. And I know can obviously create some of a burn risk or scalding risk, and especially with a little one, stuff can happen, and so just wouldn't want anything happen in that area. So yeah, but once again, really appreciate you taking the time to meet with me and listen to all that information, and provide me with all the updates and stuff. So thanks again.